Well, each year, millions of Americans are diagnosed with or treated for a long-term chronic illness, this according to the CDC. And while it can be difficult enough to cope with these conditions on our own, for parents, it can be even harder to explain to their kids.
But when it comes to serious medical conditions, some experts say that honesty really is the best policy to help them better understand what's happening. Psychotherapist Nrio Feliciano is here to help with these tough conversations. Nrio, thanks so much for joining us. This is a hard topic for a lot of families. So let's just start with the basics. What happens if you don't have this conversation?
So, and you both probably know this, kids have an amazing ability to pick up on the emotional environment. They know something's different. They might see mom or dad are stressed or sad. And what they're going to do is take bits and pieces and make up their own explanation, which is often worse than reality. It can be their worst case scenario. So we want to equip them with age appropriate truth, what they can handle, and also encourage them to know that they have the support and the resilience within to cope with whatever comes ahead. We want to help them develop those skills.
I think sometimes it's our instinct. We think we're protecting our kids, less is more, but you're saying that's actually the exact opposite. Walk us through what's the first earliest age and how do you bring that up to the younger ones, that there's a major medical condition in the family and you need them to know about it?
So obviously, Morgan, like you, if you have a toddler, they're blissfully unaware. Right. There's no need to explain anything. But as they get older, no age is off limits. Okay. It really is important to explain it to them in a way that's age appropriate with as little or as much detail depending on how old they are. So for very little kids, you want to keep things simple and straightforward. Mommy's sick. Mommy's going to the hospital to get medicine to get better. As they get into middle school, high school, everybody can Google. So they're going to want to ask for more information. They may want a diagnosis. They might want to understand what treatment looks like. It's important that you and your partner or caregivers are on the same page about what you're going to say. If there's information that you don't want them to know, make sure both of you are on the same page about that. And then when you have the conversation, make sure it's not in the middle of doing a million things. Make the time, listen, let them ask questions. Is there anything you want to know? You know, what are you thinking? What do you already know? How are you feeling? Those questions are really important. You want to let them lead the conversation so you know what to inform them with.
That's good.
What about things that are specifically hereditary, right? Which of course is going to inspire just a level of fear. I'm thinking of, you know, a child I know who had a father with a very serious mental illness. And I mean, she spent so much time concerned that this was going to come at her. Something was going to suddenly happen to her. And I remember when she told me that, I was really stunned. What a heavy weight for a child to carry. How do you treat that? Something that is hereditary.
Yeah. Again, let them lead. Start with questions. You know, what are you seeing? What are you feeling? Is there anything that you're worried about? Because they may think that, okay, when this is my fault, whatever I'm seeing, I might catch this. You want to correct misinformation, but also reassure them of the truth of things like that. Not everyone gets things that are genetic. You know, address some of the feelings. If you're fearful, let's talk about what we can do to help you through that fear, what you can do. And again, I'm sure in situations like that, there is some left to your own explanations. We need to correct some misinformation in those cases. But allowing the time to talk and really letting them listen and empathizing. I know that's scary, and I can understand why you'd be scared about that. Goes a long way in the healing process for kids.
Being open about it and introducing the data to the likelihood, the chances,
yes,
I think that
absolutely.
makes sense.
Especially as they're older.
Right, exactly, and they can process that.
Yeah.
This is such a difficult one, but we've all, I think, been in a situation where we know someone who's been diagnosed with something that is a terminal illness. If you have to talk to your child, and maybe it's not the parents, but it's a close family member, how best to address that conversation?
So hard, and really depending on how old, we want to think about the timeline. There are some older kids and kids who have more knowledge of kind of what a terminal illness actually means. They might want a little bit more time to prepare. They may want to say things to this person. They may want to do things with this person. So we want to allow them the time and give them the truth. For younger kids, it's important to know what's the level of maturity. These are situations you may want to consult a professional or anybody spiritual in your life. If you have spiritual beliefs, a priest, pastor, rabbi, imam, they can be super helpful in navigating these conversations. conversations. Not an easy one. You also want to reassure them of the people who are here to support them and connect them as much as possible with loved ones during this time. Even their peers. We want to keep things, even at a time like this, as normal as possible to give them some sense of normalcy and control in their life.
And build that network of family support.
Yes.
I think that normalcy, but also community. Right?
And normalizing feelings. You don't have to hide your feelings. You can explain, I don't know what's going to happen. It's okay to say, I don't know. Allow for big feelings. I'm sad too. I'm a little scared too. You know what? We're going to figure this out together.
Psychotherapist Nrio Feliciano, we always love when you come. Thank you so much.
Thank you.
You're watching NBC News Daily.